Hello and welcome to our Gold Learning viewers. I'm Fiona Lang-Sharp, IBCLC Director of Communications here at Gold Learning. Well, I have the pleasure of sitting down today with Kathleen Marinelli. Hello, Kathleen. How are you doing today?
I'm doing just great, Fiona. Thanks.
And I go between calling you Kathy and Kathleen because you know that we're friends and we work professionally together. So excuse me if I interchange the names, but I've known Kathy for a few years now, and so it's great to have you here working with us, Kathy.
Great to be here, and please call me Kathy. Everyone does.
Wonderful. All right. So great news is that Kathy's going to be presenting as part of our Gold Neonatal Online Conference, and she is part of a very special add-on package that we have this year called Breastfeeding in the NICU. And of course, we're just highlighting and showcasing with 4 speakers a lot of great work happening in the NICU right now, and so we're going to talk about that just in a moment here. Our conference, of course, is running right now at goldneonatal.com. You'll need to go online and check out all the local times, but you don't want to miss out on the opportunity to join us for some live events. And I'll also let you know that our keynote presenter, Jody Dolezal, she presented on June 4th. That is a free and open access to everyone. And then, of course, we're going to have Mary Kathleen. She's going to be presenting on June 18th, which is fabulous too. All free and open access for those keynotes, so that's wonderful. So let's get on and get chatting with Kathy here. Kathy, I would love it if you would reintroduce yourself to those out there listening in today and tell us a little bit about what you do on a day-to-day basis.
So I have sort of an interesting life. I am a trained and board-certified neonatologist and have been so for many, many years now. But I have not been practicing clinical medicine for a while due to a significant, actually, water skiing accident that I had. And so I've spent my time doing a lot of nonprofit work, lecturing. I'm a clinical professor of pediatrics at the University of Connecticut School of Medicine, and doing some research, and honestly doing a lot of things that I enjoy very much. They don't make any money, but they are quite fun to do. So speaking to folks like you are part of what I love to do, and this is really what I do day to day.
Well, that's exciting. And I know you're very dedicated in the field, and I know this is an area that you're passionate about, especially breastfeeding and breast milk. So let's talk a little bit about that for a moment. I want to know a little bit about how this all started for you, and tell us when you started noticing the gaps in practice for the use of human milk in the NICU.
It's a great question, Fiona, because, you know, I learned nothing about medical school about breastfeeding. I was in school in the late 70s, early 80s, and we did not learn about breastfeeding back then at all. And when I was doing my pediatric residency and fellowship in neonatology in Washington, D.C., I had a mentor, Dr. Ann Fletcher, who gave us a lecture on the importance of human milk for preterm babies. And that was the first I had ever heard about human milk, and particularly about the fact that it was so special for use in the NICU, and that really piqued my interest. I had my first child when I was a NICU fellow in Washington at Children's, and that combination, I think, is really what set me on this path. And when I left there and took my first job as a neonatologist at Hartford Hospital in Connecticut in the U.S., I was horrified to find out that virtually no babies there got any human milk, let alone were breastfeeding at all. And that's really where I saw that there was this huge disconnect between the fact that even back then we knew that there was a difference in human preterm milk from term milk, but it was not being put to use in this academic center that I had taken my first job at.
Oh, wow, that's amazing. And what a journey that's been for you, just wonderful. And that really leads us here today because you're going to be talking about best practices to support breastfeeding in the neonatal intensive care. So tell us a little bit about what you're hoping that the audience will take away from this presentation.
So I really spent my entire career, both clinically and in research and in academia, working towards making NICUs, um, bringing them up to speed on what needs to be done to enable mothers to provide their own milk for their babies, both as human milk when they can't breastfeed and working towards breastfeeding these babies, and also using donor human milk when mothers are unable to provide their milk. So I'm really hoping that after we're done today, folks will get an idea of the fact that we know it's important. We're not going to go over the data for that today. It would take us an entire day really to talk about this in depth, but that you'll understand really what the best practices are that need to be put into place to enable mothers and families and their support folks to help moms to do this and to provide what really is best nutrition, but also we talk about it as being medicine and really the best start in life for these sick and fragile babies, to really enable them to have the best possible chance at health, and not only health but survival. So it's a really kind of a big deal to talk about the use of human milk and breastfeeding in neonatal intensive care. And this is globally, this is everywhere. So a pretty important topic, I think.
Absolutely. Well, thank you so much for that. I am certainly looking forward to hearing this full presentation, and I know our listening guests will too. It just lends to really what we're looking at globally right now, and now that we know better, we should be doing better. So